Well, good morning. It's such a privilege to share space with you all today. So my name is Michelle Mabson. I'm a current Bloomberg Fellow. I'm a second-year DRPH student in the Environmental Health track. And I'm also a staff scientist at our nation's largest environmental nonprofit law organization called Earth Justice. So I want to turn to Charles Lee, who is the Senior Advisor in the U.S. Environmental Protection Agency's Office of Environmental Justice and External Civil Rights. It's a mouthful, excuse me. But it is truly a privilege and an honor because Charles is among the founders and really, I would say, a vanguard of the environmental justice movement. And it is really his work to help to ensure that communities have a space, have a voice at our highest level of decision-making in our government that is a part of some of his accomplishments and what we'll be discussing today. And so we have a pretty enormous task of discussing structural racism in the environment. We could talk about this throughout the entire summit, and in some ways I hope we do. I hope that this can spark a conversation about how we can look at institutional practices and policies that impact both the spaces we all work in, but again, are built in natural environments. And so I'm gonna ground us very briefly and then turn to Charles. So when I think about structural racism, I think it is part of the very fabric of our nation. It is, again, these institutional policies, these practices that are a part of our even cultural and our societal norms. And when we start to think about how this manifests in tangible ways, we can look at folks who do not have access to adequate education, having lack of access to adequate, affordable healthcare, and even, of course, when we think about the environment, communities that are overburdened by pollution, whether that be air pollution or contaminated drinking water. And so all of these issues compound themselves. They're cumulative in many ways, and they're acting on the very same communities that are already so vulnerable. And I think there's a space to be thinking also about history and the layeredness around our policies, especially with redlining and segregation, and the ways that that also perpetuates this type of structural racism we see today. Whole communities were relegated to areas that were dilapidated in terms of resources, in terms of receiving upward mobility. And so again, we see this manifest in very tangible ways, especially when we look at our health, which we'll talk about today. So with that introduction, I'm going to go ahead and turn it to Charles. I wanna ground us especially in what we've already spoken about with Dr. John Balbus and climate change. We know that structural racism, it's not invisible, and we're also facing a climate crisis that is exacerbating environmental injustices and also creating new and unique challenges. Can you describe for us the role that the environment plays, as well as racism, as we seek to tackle climate change, and then what is being done by the EPA to address these issues?
Well, thank you, Michelle. And first of all, thank you to the Bloomberg American Health Summit for inviting me here today. It's really an honor to speak with all of you. Let me just begin by focusing everyone's attention on President Biden's Executive Order 14096, which is on revitalizing environmental justice for all. And I think the thread that really animates the executive order is structural racism, or the legacy of racism, cumulative impacts, climate change, and systemic change, and whole government approaches. And I think that's a lot in there, but I think that's the thread that runs through it, and it's a really important way of thinking about this. Let me back up a little bit, and Michelle gave you a lot of background on structural racism, but I wanted to point out the recent work that's being done around structural racism, particularly redlining, which was a banking practice that segregated communities of color in certain areas and resulted in systemic disinvestment and environmental health outcomes. So recently, there's been about, I think up to now, 50 studies that focus on the relationship or the correlation between redlining, the redline communities and negative environmental health outcomes in terms of PM 2.5, location of power plants, in terms of cardiovascular disease, food deserts, mental health, and urban heat islands, so, and many other things. So I think the reason why there's been so much attention on this, and redlining is but one example of structural racism, is because of the work of the Mapping Inequality Project at the University of Richmond. That was a partnership between University of Richmond, Virginia Tech, and Johns Hopkins. And that obviously, it produced the digitized maps of the redline areas for about 230 some cities. And of course, what that did was to bring forth the kind of quantitative information and the ability to visualize these relationships. And so going a little bit deeper into that, you know, one of, I will note that the historian Liddell Wingling from Virginia Tech called redlining the Rosetta Stone for the spatial organization of American cities. And if you think about it, what is environmental justice but the spatial distribution of environmental burdens and benefits? And so it's really kind of interconnected. The other thing that's really important to point out is that when you think about these relationships, they're intergenerational. You know, we all know about epigenetics, and we know that this really speaks to why these health disparities are so persistent and so hard to address. So what is happening today? I would just start by kind of noting that, you know, being one of the people that helped give birth to environmental justice about, 40, 50 years ago, today is really a new day. And this is, you know, examples of this are the fact that the amount of money that is being allocated for environmental justice is now in the billions of dollars. EPA has several billion dollars of funding for communities to address environmental justice. A couple of years ago, $1 million a year for the whole country was a really big deal. So this is the kind of unprecedented change. And through it, we can reshape the relationship of overburdened, historically marginalized communities to government, both at the federal, state, local, and tribal levels. And so that's just one example. A second example is that EPA, for the past 50 years, EPA's principles for how we accomplish our mission is follow the science, the law, and transparency. And in 2021, Administrator Regan added a fourth principle, which is to pursue justice and equity. We also, EPA also elevated a couple of boutique offices, like the Office of Environmental Justice and the Office of External Rights, which enforces Title VI of the Civil Rights Act of 1964, among other things, and made it into a national program on the par of the Office of Water or the Office of Air or the Office of Enforcement. And lastly, I just want to point out, you know, so we're trying to address in new ways how we deal with cumulative impacts. The fact that overburdened communities have these multiple stressors that include environment, health, climate, quality of life, and social factors, the social determinants of health. And so one example of that, I think, is an effort in Chelsea, Massachusetts, where they're overlaying redlining maps over the maps of locations of fuel storage tanks and sea level rise. And that's just one example, I think, of how climate is becoming more and more of a factor in the way that we have to deal with these issues.
Thank you so much, Charles. And yes, thank you. That was amazing. So I know we have some limited time, and I want to just leave us with a few thoughts and then also get final thoughts from you, Charles, as well. I think that, as we were listening, I was listening backstage to Dr. John Balbus. He named that if we're thinking about climate change, we're thinking about those who can adapt, those thinking about mitigative efforts, but also those who are suffering. And I think what you just named, Charles, around the communities that are already so vulnerable and all the ways that I named earlier, in ways that many of us in this room today we're all public health practitioners, so we see this in our own spaces. And so it's really that last piece that around, I think, also the suffering, that we have a space and we have opportunity to be able to help to ameliorate, to help to improve. And when we, again, are looking across what are efforts within the environmental space, especially with what Charles named with the Environmental Protection Agency, we're seeing historic numbers around the resources that are going directly into communities that are being impacted, communities that know their own stories and that know the data and are just looking for the opportunity to be able to address and solve these issues. So I would just say, as we're thinking about the rest of the summit, it's pretty early in the morning, which is nice. Let us think about the ways in which, again, structural racism, our environment, all of these ways do permeate the kinds of spaces that we all inhabit, that we all are a part of in our society, and have these conversations. So I'm gonna leave it to you for the last word, Charles.
Thank you, Michelle. And I just want to end by looking to a quote that I was quoted on the American Public Health Association's Environmental Justice website, and let me make sure I get it right. So I said that for far too long, people of color, Native American, and low-income communities have suffered disproportionately from the devastating consequences of pollution, climate change, and other environmental health harms. Today, under the Biden administration, the nation is finally taking substantial steps to right these wrongs and eliminate health disparities. So I ask you to join us in advancing this exciting era of truly transformative change for environmental justice and civil rights. Thank you.